Did you know that for every 10 pounds of excess fat, we make an extra mile of vasculature? In other words, the more weight we have, the harder our body has to work to pump blood through these extra miles of blood vessels, and this puts a strain on your heart. If you have heart disease or high blood pressure in your family, or you're already suffering from these conditions, then you'll want to tune in to today's video. I'm going to be talking about some well-known risk factors for heart disease and high blood pressure. And in addition, I'm also going to give you some really surprising facts that when I first learned about these facts, I was really startled to see that even I fell into some of these higher risk categories. Naturally, this prompted me to do a little bit more research and learn how I can minimize my risk factors and improve my own heart health. And today I want to share these things with you. So it used to be that a blood pressure of 120/80 was ideal, and that anything under 140 was okay. But that all changed back in 2003 based on more current research, and the new data shows that 115/75 is now the new ideal. Now, anything over 130 for that top number, that's the systolic blood pressure, is considered hypertension or high blood pressure. Plus, the research also concluded that systolic blood pressure is more predictive of heart disease than that bottom number, which is the diastolic blood pressure. But that's not the big surprise. The big surprise in the latest research is that for every 20 points that top number increases, you double your risk for heart disease. So at 135, you now have double the risk for heart disease. And for every 10 points that the bottom number, that diastolic blood pressure increases, our risk for heart disease also doubles. According to the CDC and this new data, nearly half the adults in the United States have hypertension. It's almost 50% of the population. That's a systolic blood pressure that's greater than or equal to 130 and a diastolic that's greater than or equal to 80. But typically, they don't start medicating for high blood pressure until you reach 140, as per the new medical guidelines, because they've developed basically a wait and watch program. Wait and watch as your numbers rise and your risk factors continue to double with each increment. So there's this gray zone where your blood pressure begins to elevate at 120 and then creep up, and as those numbers creep up, your risk factors are also doubling and then quadrupling. And I don't know about you, but waiting and watching isn't my thing. And taking unnecessary medications with multiple side effects really isn't my thing either, because I know that we have lots of tools and mechanisms that we can use to act preventatively rather than waiting around to be a statistic. You see, this isn't inevitable. It's not dialed into your genes for this to happen, because almost all of the risk factors for this are related to the food you eat and the lifestyle you lead. Your top risk factors for high blood pressure and heart disease are: number 1, lack of exercise and sedentary lifestyle. 2, being overweight, especially if you carry extra weight around your midsection and your belly. Number 3, a diet that's high in sugar. And 4, a diet that's high in fat. And really what I'm referring to here is unhealthy fats like fried foods and processed foods, foods that are filled with salt and preservatives like chips and French fries, a diet that maybe is heavy in meat but very little vegetable consumption. And then we have insulin resistance, prediabetes, and diabetes as major risk factors. And smoking and excessive alcohol use are also major risk factors. And we can't forget that stress, on top of all those other things, plays an important role in the health of your heart as well. Heart disease is the leading cause of death for men and women across all racial and ethnic groups in the United States. And ladies, we are just as at risk as the men, but our symptoms may present differently. Did you know that migraine with aura in women is considered a major risk factor and a red flag for cardiovascular disease? I can't reiterate enough. The genetic piece of this applies only to a small minority of the population. In most cases, it's a combination of the dietary and lifestyle factors that are determining your risks. This is completely in your power to lower these risks. And that brings me to the top 3 things you should be doing right now to lower your risk factors. Number 1, know your blood pressure. If you don't already have a blood pressure cuff at home, any of the Omron blood pressure cuffs that you can purchase on Amazon would be good. Omron is a good, trusted brand. Take your blood pressure at least a couple times per week and start monitoring where you're at. Know your numbers. That's the best place to start. Find out, are you already in that gray zone? Is your blood pressure over 120? Number 2, move your body. Don't sit for more than 30 minutes at a time. Make sure you get up and stretch. Too much sitting in and of itself is a risk factor. So start exercising, even if it's in small amounts. Start getting your heart rate up. And number 3, clean up your diet. Lower your sugar intake, watch your alcohol intake, make sure you're eating a green vegetable now and again, and eliminate your processed foods. Need help on where to begin? Call my office and I'll begin to guide you and help you get started. And stay tuned for my next videos where I'm going to talk about your top heart healthy foods to be eating every single week. Thanks for joining me. I'm Dr. Emily. I look forward to speaking with you next time.